Welcome back into Wave Listens Live. I'm Michael Vanna. We're joined now by Dr. Kane from Cornerstone Wellness. And Dr. Kane, welcome back into the show. It's good to see you again.
Thanks for having me, Michael. Great to be here.
Absolutely. All right, so one of the things that you always talk about when you come on is that of neuropathy. And I think it's so important to continue to educate this community. But before we jump into that, if you would, let's talk about Cornerstone Wellness briefly with an overview.
Okay, so I've been in chiropractic practice for 31 years, all that time here in the Louisville metro area. Office is currently in New Albany, Indiana. I've been there for about 20 years. Just kind of, you know, the holistic viewpoint of chiropractic, it changed my life as a teenager, and so I felt like this has been my calling. But then more recently, in the last few years, have kind of fallen into neuropathy reversal by virtue of my mom. Okay. So that's how I landed with that.
All right, and when you, as I said, you always come on, we're talking about neuropathy. Let's do a quick reset on neuropathy. What are some of the symptoms and overview, I guess you could say?
Okay, so neuropathy is simply where the nerves aren't communicating with the brain properly, so we get abnormal sensations. The most common one is just excruciating pain, and those people are really motivated to get something done. We can have more annoying type issues like pins and needles, or feel like insects are crawling. It can be hot or cold abnormalities. Instead of just being hot or cold, they just feel like their feet are absolutely freezing and it's painful. My mom complained, felt like she was wading in lava, so those are the type of symptoms. Now, then there's an absence of sensation that we would call numbness. Those people aren't quite as motivated because, you know, if it doesn't hurt, it's not a problem. That's kind of the conventional wisdom the patients have, but they're at the greatest fall risk because all of these cause balance issues. So we know that can be very injurious and quite frankly fatal at times. So if you've got a situation where you're dealing with numbness, we really need to get on this and deal with this quickly, because that can change your life in a heartbeat.
Very quickly, sooner than later, as you say. What is a common denominator that you see when you're dealing with neuropathy?
So great question. There's over 100 different types of things that can cause neuropathy that is in the medical literature. The most common is diabetic neuropathy. The second most common is chemotherapy-induced neuropathy, which is how my mother was affected. We see what I would call orthopedic-related neuropathies, where there's been injuries or surgeries to the back, the legs, the hip or knee replacements. It can happen in your hands as well, but it's most common in your feet. But the common denominator in most all of the neuropathies is a loss of blood flow to the nerve cells. And so I know we have a graphic to look at here.
Yeah, we were actually able to get all the images, I think, so we're going to show some things on screen
Wonderful.
here. Yeah,
wonderful.
Okay. Go ahead and talk us through it.
So what we're looking here is a couple thermal images. The one that would be on the right side of the screen, we've heard phrases like red hot or white hot. Well, when we're looking at thermal imaging, that's what we want to see. This is a heat representation, and the slide on your right, you can see it's red all the way down to the toes. This person has great blood flow, great circulation. The before picture on the other side of the screen, you can see once you get down into the feet, it's yellowish, it's greenish, it's actually kind of a dark blue when you get down to the toes. This is someone who is suffering with neuropathy. Those nerves aren't working properly, they're not communicating to the brain, and they have symptoms. Now, the cool thing is, this is the same patient pre and post 90 days treatment in our office.
Wow.
So this is how, when we reverse neuropathy, it is all focused on making sure that we can restore that blood flow. Blood brings oxygen and nutrients. And if that cell's not getting those, they're literally starving and suffocating. And so when we return that blood flow to normal, those cells can heal and recuperate.
Is this thermal imaging, is that part of a consultation? Or
yes,
no?
Great question.
Wow, okay.
And one of the reasons I wanted to explain this today is we have people frequently, and in fact we had a lady walk in this morning to say that, you know, I've already had a blood flow study done in my legs and they were normal. Well, when we have a Doppler ultrasound of the blood flow on our legs, they are measuring large and medium-sized arteries. We're not looking at that. We're looking at capillaries. So what you're seeing here, the top, these are 3 nerve cells. The top one, you will notice, has good blood supply, so that's a normal, healthy nerve cell. It functions properly. The one in the middle of the screen, we're seeing that we're starting to get disruptions in the blood supply. So this is a person that is beginning to have neuropathy symptoms. And the one at the very bottom, we can see that the blood flow is absent at this point. It's broken down. This nerve is not functioning properly. And if we wait too long and you're getting in that category, we may have some degree of permanence. We can still help improve some things, but there may be some degree of permanence at that point. Well, getting early help is important.
Yeah, I think it's interesting when you talked about the thermal imaging we were just showing. People always want to say, well, what kind of results are you going to get me? How am I going to feel, right? They say all this. Well, you're actually showing people literally.
Absolutely.
I mean, look at the before and after.
If you can measure it, you can change it.
Yes,
and
right.
we want to have that objective feedback so people know that we're, that they're going to feel it. They're going to, the pain, the numbness, the tingling, that stuff goes away, balance improves, and so forth.
Inevitably, neuropathy affects so many people, and there's a lot of people watching right now, Dr. Kane, that are probably suffering by some of the symptoms that you talked about. Of course, the phone number, the website's on the screen, but what would you tell people that are kind of hemming and hawing, or maybe they're like, I'll call eventually. How important is it to take action right now?
Don't wait. Time is of the essence. It's like treating anything, any disease process, cancer, whatnot. The earlier you get it, the earlier you catch it, the better results you're going to have in a shorter period of time. One of the things, you can go to the website, you can actually see other episodes of where we've been on Wave Listens. You can see testimonials by other patients we've brought on here before, and you can hear it from the mouths of others with the results that they have gotten.
Yeah, it's amazing. Real quick before I let you go, what's the process like? They call over there. How quickly are they getting in? How long is the appointment? Take us through that a little bit.
Great question. We had a gentleman that saw us last time we were on here on a Monday. We had him in here Tuesday. He began treatment that afternoon.
Wow.
And a week after that, he was already beginning to see some results. So call our office. You'll speak with Angela, who was with me last week, our neuropathy coordinator. We'll get you scheduled very quickly. We'll go through a complete evaluation, make sure you're in the right place and we can help you and get you started.
I like that. You practice what you preach. You say, hey, time is of the essence. You're getting them in. Let's go.
We do.
You got to get started. So, all right. Well, we appreciate it, Dr. Kane. Thanks for being here.
Thanks
as
for
always.
having me.
We appreciate, again, the phone number on the screen, 812-949-0900 or mydrkane.com. All right. When we come back, we're going to talk to our friends from Discover Southern Indiana. We'll be right back on Wave Listens Live.